Have you ever had a patient that you had trouble bagging because their tongue kept getting in the way? Or you don't have the grip strength to maintain a jaw thrust for over half an hour?
There's gotta be a better way.
There is! Introducing the new oropharyngeal airway, or OPA, made of hard, sturdy plastic, designed to keep the tongue out of the patient's airway, making it easier for you to bag and reducing your need to do a jaw thrust. Easy to use! Now, let's go to our expert instructor to see how to size and insert an oropharyngeal airway.
Hello everyone. Today we've got a oropharyngeal airway, or OPA, that we're going to show you how to insert. Now, observe that it's got a curvature that should follow the curvature of the tongue back into the oropharynx. In terms of inserting it, well, first we need to figure out how to size it because OPAs come in a few different sizes and colors. So we'll show you that in a second. Just remember that the OPA is quite a rigid structure and it goes to the back of the throat. So you can imagine if you stick it in someone who's still awake, they're going to gag and vomit and aspirate and you're going to have a nightmare. So just make sure you're not doing that. Anyway, with that out of the way, let's go over to the mannequin and size up an OPA. So, we've got a patient's head here. Let's size up an OPA. OPAs come in a few different colors and sizes. You can see the red one's bigger than the orange one. To size it up, we want to measure from the tragus of the ear, which is that pointy cartilage thing, and the angle of the mouth. If an oropharyngeal airway goes from the tragus of the ear to the angle of the mouth, then it should fit perfectly and we'll be able to insert it and it will sit in the right place. But if it's too short or if it's way too long, then you should try find a different size one, just try a different color. You can even just measure it in the packaging, just like that. One pro tip, you can see that if you take this orange one, which is a bit short, and then angle it like this and sort of squeeze it like that, you can kind of make it fit, so that's cheating. We don't want to cheat while we're managing a patient's airway. So instead of laying it like this, what I want you to do is lay it over the patient's head like this. You can see it's arching like that, not like that, because that will pivot, that you can't cheat. Okay, now that we've sized up the OPA from tragus to the corner of the mouth, let's see how we can put it in. First of all, grab the patient's jaw so that you can apply a bit of a jaw thrust, opening up the space behind the tongue. Next, you can see that the OPA is quite curved, which means if we put it straight in, it's not going to go anywhere, the tongue's going to get in the way. So what we want to do is insert it in backwards. And if we do that, we can go up here until we meet the top of the mouth, which is called the hard palate, and we can't advance it any further. So, easy way to fix that, we can swivel it 180 degrees when we're at this spot, and the OPA will just naturally fit in place with the curved part of the OPA sitting on top of the tongue nicely. Once it's in, you can just put your bag valve mask over and continue bagging, and you'll notice that you have a much more open airway even if your jaw thrust is weaker. And to pull it out, pull it out like that and then you're all done. So one more time with the OPA, a little bit of a jaw thrust, OPA, flip it backwards, insert until you get to the hard palate, swivel 180 degrees, and then you're in.
But wait, there's more! Order now, and we'll include this nasopharyngeal airway for free. That's right, free! This nasopharyngeal airway is a very soft plastic and it doesn't reach the back of the patient's throat, meaning they won't vomit, gag, or aspirate on their own secretions. You can insert this in patients with more consciousness than you would for an OPA, such as a drunk person. Now, let's go back to our helpful instructor and see how we can size and insert an NPA.
Hello everyone, so this time we've got a nasopharyngeal airway which just goes into the nostril all the way to the back of the nose into the nasopharynx. So it doesn't bypass the tongue, but it's still a bit of an open airway, so it'll give you some benefit while you're bagging a patient. This one doesn't go all the way into the back of the throat, it just sort of sits in the back of the nose here, so it doesn't trigger a gag reflex, which is great in patients that are kind of awake but not awake enough to be a good bagging experience. For example, an intoxicated patient. So, like with the OPA, let's just jump over to the mannequin and learn how to size this baby up. Okie dokie, so we're back to the mannequin. In terms of inserting an NPA, very similar to the OPA, but instead of from the tragus of the ear to the angle of the mouth, we want to go to the nostril instead. So we've got a nasopharyngeal area here. Let's see if it fits. Hooray! So that'll go in nicely. But you can see this one will just be a bit short, so it'll just be dangling somewhere in the nose. So we can just throw that one away and go back to the right size one. All right, let's show you how to put in an NPA into a patient's nostril. First steps first, lube up your NPA. Just put a thin layer of Surgigel on top of the NPA so that it will go in nicely. Next, choose a nostril. Doesn't matter which one, you have a 50-50 chance of succeeding. In terms of pushing it in, remember that the nostrils point upwards, but the actual anatomy of the nose is that it goes straight down, so perpendicular to the ground. So don't go this way, go this way. All right, so let's try that, all lubed up. Let's try push that NPA gently in the nose. Sometimes you can put a bit of swivel action in, and you should be able to pop it all the way to the back of the nostril. And voila, that is all done.
Wow, 2 amazing products for the cost of $0 and 3 easy payments. Order yours now, and you can look as cool as these emergency doctors managing an airway in this video.
Can you put an OK NPA in while you're doing that?